Dr. Alexander Khalessi. I'm professor and chair of neurological surgery at UC San Diego Health. As a surgeon trained in open cranial surgery and the use of catheters to treat problems in the brain, I focus on complex brain tumors, so that can be primary brain tumors or metastatic tumors to the brain. I also treat complex vascular conditions like aneurysms and AVMs, and I also treat issues with blood flow to the brain, and so that can involve using catheters to treat strokes or carotid disease, either with endarterectomy or with carotid artery stenting. Being a physician is a unique privilege. You're invited into the critical moments that define people's lives, and so building that relationship and trust is really important. And seeing the courage that my patients demonstrate in really adverse situations is inspiring. You know, when I think about a patient's problem, the first and most important thing is to understand their goals. Often someone with a neurologic deficit presents to me in a situation that's short of the fuller person they've been in their lives. And one of the advantages of being at UC San Diego is I have the opportunity to partner with an entire team. And so that can range from neurointensivists to stroke physicians to a much broader neuro-oncology team. And so being able to put that full picture together as a surgeon is a real luxury and an advantage. The other key advantage in terms of my own personal approach is to make sure that in looking at a patient's problem and their structural issue with their brain, how can we best leverage technology to keep that patient safe and get them back to their lives. We're really living in a time where we're able to reach those portions of the brain in a way that we couldn't before, and that gives me the opportunity to offer patients much more in the way of hope. Neurologic disease can be disabling, and it's often difficult to have a good sense of what you or your family member's prognosis would be, and that's particularly true in brain tumors and vascular problems. And so if there ever is that concern because of the advances that we've made, I would really encourage people to seek an opinion at UC San Diego Health because we have capabilities and teams that can maybe offer hope and treatment in situations that may be less clear in other environments.